Good afternoon, thanks for joining us. I'm Judy Simpson. Our focus today is on a new national report from the American Lung Association. The report looks at 5 key areas of tobacco policy in each state. The Lung Association's 2017 report card for Vermont gives the state high marks for the strength of smoke-free workplace laws, but the state gets a failing grade when it comes to enacting a minimum age of 21 for the sale of cigarettes and other tobacco products. While Vermont generally receives higher marks than other states for its tobacco policies, the U.S. Department of Health reports that the use of tobacco remains the single most preventable cause of disease, disability, and death in the country. To find out more about the report, including resources to help quit smoking, I'm joined by 2 guests. Rebecca Ryan is the Senior Director of Health Education and Public Policy of the American Lung Association in Vermont. And Dr. Keith Robinson serves on the Leadership Board of the Lung Association in Vermont. Dr. Robinson is a pediatric pulmonologist at the UVM Children's Hospital. Thanks so much for coming in.
Thanks.
Now, before we get to the specific details of the new report, there are proven strategies. Are there proven strategies and methods for preventing tobacco use?
There are 3 that states can implement, and the first one is to fully fund a comprehensive tobacco control program, and that includes things like smoking cessation, resources, media campaigns, enforcement of tobacco laws, school and community-based programs, and program evaluation. The second is clean indoor air laws, and that does 2 things. One, if kids think that smoking is not the norm, they're less likely to start smoking. And secondly, it motivates many adults to quit smoking. And the third is increasing the price of tobacco products. We know from evidence over the years that if you increase a significant increase in the excise tax of 10%, raising the pack price by 10%, that'll reduce youth smoking by up to 7%, and 3 to 5% of adults will quit smoking because of that.
Let's take a moment now to look through some of the grades that Vermont received in the new Lung Association report and get your input here. The report looked at 5 areas of tobacco control, and starting on the left side of the screen, as you can see, the first category is Tobacco Prevention and Control Program funding. Vermont got a D.
We did get a D, and the CDC, or the Centers for Disease Control and Prevention, recommends that Vermont invest $8.4 million in tobacco control efforts, and we currently spend about $4.2 million, and that includes federal dollars. So it's only 51% of the recommended CDC. If we had more money for the program, we could enhance some of the work that's being done. In addition to that, the state receives $110 million each year from the Master Settlement Agreement from the tobacco industry, in addition to tobacco taxes, and only a small percentage of that is dedicated to tobacco control prevention.
And what would you have to say about that, Doctor?
So the traditional model for medicine has always been to focus on treatments, but over time, we're realizing that primary prevention is the key, and so we have to really focus on prevention so that we save costs both now but also in the future. I mean, we're paying now, our healthcare costs now for smoking that's a result of the rate of smoking decades ago.
Right. All right, well, the next issue analyzed in the report was tobacco taxes in Vermont earned a B.
A B is pretty good. Our excise tax is currently $3.08 per pack of cigarettes, and we have the 6th highest tax in the country. However, we got there by incremental increases, and as I mentioned earlier, that it needs to be a significant big hit of a tax increase to really impact smoking rates.
What would you like to see?
Well, we'd like to see at least $1 increase to raise that. Our neighbors in New York right now are at $4.35 a pack.
Wow.
And that's the highest in the country.
So what does a pack of cigarettes cost then?
The average pack price in Vermont is about $9.60.
For a pack of cigarettes?
For 1 pack of cigarettes.
That's unbelievable. And people are still shelling that out.
That tells you the power of the addiction.
Right.
Wow. Okay, well, Vermont's best grade in the report came on the smoke-free air category. The state got an A. That's good.
The state has been receiving an A in this category for many years. We've been doing this for 15 years. I think we've had an A probably for at least the past 5 or 6 years. We've been a leader in the country in this effort. In 1987 was one of the first in the nation to limit smoking in workplaces, and been doing that ever since. And we got a nod for adding electronic cigarettes to the laws in the past year.
Okay, the next category is access to cessation services. Why did Vermont get a B?
That's a fairly good grade. It would have been an A, except for there's a robust medication benefit for Medicaid recipients. However, there are co-pays, so we would like to see that barrier eliminated so people can get access to all the medications without paying anything out of pocket. And the same goes for the state employee health care plan. We did get a boost because we invest a little bit more in per smoker for the Vermont Quit line than the national average, so that was good news.
And the final category in the Lung Association report was Tobacco 21, in which the state got an F.
Yes. Most states got an F.
Oh, okay.
This is a new tool for lawmakers to consider, but a report came out in 2015 by the Institute of Medicine, now the National Academy of Medicine, showing that we could reduce the current teen today, we could reduce smoking by 12% by the time they're adults and save nationally over 223,000 lives by implementing this.
So have people who sell tobacco products have to be 21? Is that correct?
No, it would be people who to purchase
cigarettes.
Yeah.
Right. Yeah. Well, talk a little bit about that, because what is it when you turn 18, all of a sudden you feel like, oh, now I can do this legally, so I'm going to go out and buy those cigarettes?
In terms of what drives kids to do it, and there's many factors I think that go into it. I don't think there's any one particular factor that drives a kid towards smoking. I think if you're growing up and you see your parents smoke, that certainly is going to drive you in that direction. If your peers are doing it, that certainly will do it too. And then another phenomenon, and this has been well documented, is the advertising around these products is a big hook for these products. And so there's many factors that go into it, so it's hard to point to just one, and that's why we need comprehensive programs to address all these.
Now, you both are on the front lines of tobacco education and prevention. Grades aside, how is Vermont doing to prevent and reduce tobacco use, do you think?
Well, overall, the success of the tobacco control program has really led to historic low smoking rates, and that includes Vermont. Our current adult smoking rate is 16%. It was 21% in, I believe, 2000. The youth smoking rate has dropped dramatically. In 1999, 33% of our high school students smoked, and now it's down to 11%. So, and due to these declines, Vermont has saved $1.43 billion since 2001 in related health care costs. That's really dramatic.
That is
declines.
dramatic.
Yeah.
Let's talk a little bit about some of the things that you were talking. What I thought was interesting, and there's some statistics here. 27% of adults with depression smoke cigarettes, and 17% of women smoke cigarettes during pregnancy. That surprised me.
It is surprising, especially when we know so much about what smoking does, for moms that want to become pregnant, that are pregnant for the babies. And so for women that are trying to become pregnant, it can actually make it harder to become pregnant. For women that are pregnant, it actually can increase the miscarriage rate. And for babies that are born to moms who smoke during their pregnancy are at high risk of being born prematurely. And when we look at prematurity across the nation, it's the highest risk of death, disability, and disease among infants. And so there's a lot of risk to moms that want to become pregnant, that are pregnant, and to the babies. And most strikingly, the SIDS rate is 3 times greater for babies that have a mom who smokes. So there's a lot of reasons, again, why we should focus in on moms.
And that's sudden infant death.
It's correct, yes, thank you.
And so why do you think that is, as far as for the babies? Is it just long-term health implications?
There are many long-term health implications. I mean, there's risk associated with prematurity, but then also there's other lung and brain development for babies as well.
Now, we've talked mostly about smoking. What about other tobacco products like e-cigarettes or smokeless cigarettes that are out and about?
E-cigarettes are a new phenomenon, and new in the last several years. And as our smoking rates are coming down, they're not coming down as vigorously as I think we would want them to. And one thing that's happening is the smoking rate is coming down, e-cigarette rate is going up. And the danger is a couple of things. One, we don't know that much about e-cigarettes at this point, but we do know a couple of things. We do know that e-cigarettes contain nicotine. And we all know that nicotine is addictive and will lead to other forms of tobacco use, including smoking. So if somebody's using e-cigarettes, teens especially, are at a higher risk of using cigarettes, traditional cigarettes. There's impacts on nicotine and e-cigarettes on brain development, on behavior, including risky sexual behavior, illicit drug use, things like that. So there are some associations that we're now finding, and these were just published in Pediatrics, which was a journal that Dr. First edits here at UVM Children's Hospital.
What is an e-cigarette?
So an e-cigarette is a liquid vapor, a liquid that turns into a vapor. And so most commonly the base is propylene glycol. And when you have an e-cigarette, it's in a device where there's a battery element that heats it. And through the process of heating it, it actually turns the propylene glycol into formaldehyde. And if you've heard formaldehyde before, you may have heard it in the context of it being a carcinogen, which we know that it is. And so in addition to nicotine, again, which we know is addictive, it also has formaldehyde, which is a known carcinogen.
And so the thinking is, it's an e-cigarette, it's safe.
That's been some of the
Safer
advertising.
than,
Yeah, I mean, so some people are looking at it as a smoking replacement. In other words, like a traditional cigarette replacement. But that literature is not solid yet, and there's some to say that it doesn't work.
And the U.S. Food and Drug Administration is just beginning to regulate electronic cigarettes like they do traditional cigarettes, so that's the good news. The other thing that's potentially dangerous about electronic cigarettes is there's a lot of flavorings added and appeals to kids, cotton candy, bubble gum, chocolate, and there's a component in flavoring that, I'm going to pronounce it wrong, but I believe it's diacetyl, that causes, you've heard of popcorn lung for people that work in popcorn factories.
Yeah.
It's the same additive that potentially could cause great harm to lungs.
Yeah, so as a pediatric pulmonologist, I'm very concerned when I see adults or kids, putting this stuff into their body, especially their lungs, when we know that there's so many, effects that are dangerous acutely, but we don't know anything about the long-term health implications of these things.
And then there's also something called vaping.
There is.
Which is, can you explain what that is?
So vaping it's like e-cigarettes, except you take the nicotine out. So you still have the base and the flavorings that Rebecca mentioned, and it's supposed to either mimic cigarettes or just be another alternative. But again, with that, we don't know the long-term health implications, but we do know that some of the substances that you're ingesting into your lungs either can't be cleared or can be associated with carcinogens.
So what do you do to encourage parents to quit or not smoke indoors?
That's a great question. So I see problems with smoking all the time in clinic. I see it in regard to increased asthma attacks, increased infections, things like that. So understanding the importance is really important for patients and families. And I approach that the same way I approach quality improvement. I'm also the quality improvement director at the UVM Children's Hospital. And whenever we set up a project goal, there are several steps in order to get to that goal. And so what we try to do is build small wins. And so for parents and for patients, I always say pick one or two things that we can do now to make an improvement. So the first thing I usually recommend is don't smoke in the car, don't smoke in the house. The next thing is
That's a pretty easy thing to accommodate if you're a smoker.
Yeah, it's build a small win. You have to, and celebrate it. It's a big thing to stop smoking. It's a big thing to not smoke in the car, to not smoke around your kids or grandkids. And so that's really important. The second thing is, build the environment around you that's going to lead to success. And so a lot of times the triggers for smoking are an environment that, where other people smoke or where it's expected. So try to reduce the environment, or at least talk to your friends and family and say, listen, I'm trying to cut back, I need help. Because everybody does need help.
Right.
And then from there you can build on about cutting back and then eventually get that goal of quitting. But in the bigger picture, it's really important to realize that you can't flip a switch. It's not that easy. It's a long journey, it's a long process. There are ups and downs in the whole process of quitting to smoke. But again, you need a support network, including your primary care provider, to help you do this.
Okay. Now, what resources are available to help folks quit tobacco? Because there are several.
There are, and that's the beauty of tobacco control program funding. The state invests in smoking cessation resources, and Vermont has a good program. People who are ready to quit can contact the Vermont Quit line, which is 1-800-QUIT-NOW, and talk to a counselor immediately. They can also go to, if you just search for 802-QUITS, it'll go straight to the 802-QUITS website, and they'll provide, and that provides again an option to sign up for online counseling, phone counseling. If they want to meet with a counselor at a hospital, they can do that through the Quit Partners. And they can also get free nicotine replacement therapy delivered straight to their home, and that will double their chances of quitting.
So the big step is to just make the decision to do it.
Right. Make sure, you have the hook into the resources that are available now, and also talk to your primary care provider too. I think there's a lot of resources that your primary care provider can provide as well, and support, encouragement, and then really helping you set that goal and work towards it.
Well, I want to thank you both for joining me today. Important messages.
Thank you.
That's our program. Thanks for joining us. I'm Judy Simpson. We'll see you again next time on Across the Fence.